Today we are going to see about low blood pressure. No, we all know about high blood pressure and its effects. We are going to see in today's video about low blood pressure. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, health related explanations are provided via simple videos which are released every week. If you want to see such videos, kindly subscribe to this channel. Also press the bell icon adjacent to it to get instant notifications whenever new content is released. This week's video is about low blood pressure or hypotension. Now, as we say about high blood pressure, this is termed as hypertension. Low blood pressure is termed as hypotension. Okay. What is blood pressure? So, it is the force or the pressure exerted by the moving column of blood on the blood vessels. Because blood is pumped from the heart, this generates a pressure, and the flow itself will generate a pressure. And this blood pressure is mentioned by systolic and diastolic. You have two numbers, one above the other. The one on top is called systolic blood pressure. The one below is called diastolic blood pressure. Systolic blood pressure is the pressure exerted on the walls when the heart is pushing, pumping, contracting. And diastolic blood pressure is the pressure when the heart is at rest, when the heart is receiving the blood. So these are the two numbers. These both numbers are important. What is a normal blood pressure? Like any other biological parameter, this has a wide range. So anything above 130 and 80 is called as high blood pressure or hypertension. Previously this number was 140/90. Now because of the bad effects it generates, this number has been changed to 130/80. Anybody having a blood pressure of more than 130 or 80 is termed as hypertensive. But you may not necessarily always take medicines for this. Based on how you respond to medications, lifestyle measures, your doctor will advise against that. But what about low blood pressure? The normal blood pressure is 120/80. So anybody having lower than that is low blood pressure. No, the lower limit of normal blood pressure is 90/60 millimeters of mercury. So even though we say normal is around 120 or 110, the lower limit of normal is 90/60. Anybody having a blood pressure of less than 90/60 is termed as hypotensive. So what about 170? I usually have 170. Many females usually have 170. This is a normal blood pressure. This is not low blood pressure or hypotension. What are the causes of true low blood pressure, that is less than 90 or 60? You can have around three types. One is called postural hypotension. Whenever you get up, you get a drop in blood pressure, so you feel dizzy and you may fall down. Why does this happen? We can understand. Whenever you stand up, blood gets pooled in the lower part. God or nature has designed mechanisms to prevent the pressure from dropping down. But as age gets older, these mechanisms may fail and you may get postural hypotension. Usually, elderly may suffer from postural hypotension. Pregnancy, some diseases like Parkinson's disease and diabetes mellitus may also cause this postural hypotension. You can have postprandial hypotension, meaning after eating a heavy meal, you may have a drop in blood pressure. And you can also have neurally mediated hypotension when you stand for long periods of time. So in jobs involving standing for long periods of time, without moving much. So you may have a drop in blood pressure. And you also have a serious cause of hypotension, like when you lose a lot of quantity of blood or fluid from inside the body following an injury or following diarrhea, dehydration. You may land up in shock. This will result in a severe hypotension. That is a dangerous condition. But for normal individuals, normally moving around individuals, those three are the most common causes of hypotension. Now, what are the symptoms associated with the hypotension? As we see, lightheadedness, dizziness, you may fall down, you may have feeling of nausea, your skins may appear very cold and clammy. So all these things can result from hypotension, but not all dizziness or lightheadedness is due to hypotension. We have to understand that. There are so many other causes also. So if you feel any of these symptoms are there, you might require checkup with your doctor who will diagnose this condition. For postural hypertension, Your BP needs to be checked for when you are sitting down as well as standing up. So it's not a simple measurement. And just a mere low normal blood pressure like 170 or 110/70 doesn't indicate hypotension or any treatment. How to treat or prevent this hypotension from happening? We know about the causes. Just managing those causes will treat this hypotension. Drug treatment of hypotension is very rare. It is usually required only in emergency situations for shock. Other times usually you don't require drug treatment. As I said, for postural hypotension, you may need to slow down. Just when you wake up, don't suddenly get up from bed. Just turn to one side. Be there for a little time. Sit up in the bed. Be there for a little time. And then you get up. This way you can prevent from postural hypotension and your dizziness and falls from happening. Similarly, for postprandial hypotension, we can just avoid heavy meals. If you just split these meals into smaller size meals, you will avoid this postprandial hypotension. For neurally mediated hypotension, just move around. In jobs involving long periods of standing, in between take a break, move around, sit down for a minute. So this itself will prevent this hypotension from happening. So no drug treatment is essential. So ultimately, most of us get worried when we see readings of normal blood pressure itself, 170 or 110/70, we think we are having low blood pressure. That is not true. A true low blood pressure most often can be managed by simple means, but if you are sick, really sick, in shock, you may need treatment. That will be obviously done in an emergency room or an intensive care setting. Generally, we need not worry about just a mere drop in blood pressure or a mere normal lower blood pressure. Hopefully, this video would have cleared your doubts regarding low blood pressure. If you found this video useful, kindly share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again. Bye.